Welcome to the Finding Financial Freedom podcast with the Frugal Physician, where Dr. Disha Spath will be your companion on this exciting financial adventure. Get ready to conquer debt, build wealth, and embrace a mindful spending lifestyle that will empower you to live life on your own terms.
Let's face it, the system wasn't built with women doctors in mind. From wage gaps and burnout to caregiving and ownership challenges, women in medicine face real financial headwinds. That's why Earned offers fully integrated planning, led by a diverse team of advisors who understand the challenges of a career in medicine and what it's like to be a woman navigating it. Earned's Dr. Wealth Playbook includes investing, tax planning, career strategy, and estate planning, all designed to help you maximize your time and build your wealth more tax efficiently. And for a limited time, Frugal Physician listeners can visit earn.com/frugal for exclusive access to this comprehensive planning at a discounted rate. Go to earn.com/frugal to secure your discounted rate, because you've earned it. That's earn.com/frugal. Welcome back to the Finding Financial Freedom podcast with the Frugal Physician. I'm your host, Dr. Disha Spath. Today, we're digging into how physicians can build more than a solo practice, how they can build shared infrastructure through an MSO to make direct primary care stronger while maintaining each practice's independence. Sounds too good to be true, right? Joining me as a special co-interviewer today is Dr. Dhanushan or Dan Sooriabalan. Dan, please introduce yourself.
Thanks, Disha. It's an honor to be here, first of all. So I'm Dr. Dan Sooriabalan. My patients call me Dr. Dan. I'm a board-certified internal medicine physician, so an internist. I'm also the owner of Sooriabalan Medical, which is my last name, medical on the end. It's a direct primary care practice here in Malta, New York. So, I worked at a large healthcare network for about 12, 13 years, and I wanted something different. I wanted to be there for my patients and focus on more continuity of care, relationships with my patients. So, thank you for having me. And I'm definitely pumped, Natalie, to have you on the show. And if you're looking forward to just telling us how you scale collaboration just beyond one clinic to involve multiple clinics and multiple providers. So thank you both for having me.
Yeah, absolutely. It's my pleasure, Dan. Your practice is such an inspiration to all of us in this area. You've been one of the oldest DPCs around, and I can't wait to talk to Natalie. Our guest today is Dr. Natalie Gentile, family medicine and lifestyle medicine physician, proud Pittsburgh native, founder of Gentile Family Direct Primary Care and co-founder of Direct Care Physicians of Pittsburgh, and MSO supporting independent DPCs. She's also founded Rebel Wellness in Pittsburgh's East End, leads Walk with the Doc, Highland Park, and serves on community boards. Jesus, Natalie, I couldn't even get through that. You do so much. It sounds so tiring. Welcome, and tell us what you've been doing.
Thanks for having me. I'm really excited to be here. We met at the DPC Summit, so it's so awesome to have this collaboration, and meet again. I'm a busy woman over here in Pittsburgh, Pennsylvania. I'm a mom of two littles. My husband's a surgeon here in Pittsburgh, and I own a direct primary care practice. I actually am celebrating tomorrow 6 full years since I opened doors. So it's an incredible feeling. And a lot of what I've done, which I'm sure we'll talk about today, has all come from a motivation and passion and just the central mission-driven state of being where I want to serve my community. I want to be a community family doc. And I'm trying to do that no matter what business I open, right? I'm trying to do that through that direct contact with the patient and with the community and doing it in a way that really feels genuine and resonates with me.
Oh my gosh, that is so inspiring, and mission driven is exactly the way I think every business should be. We should always stay true to our core values. But before we really dive into this MSO that you've built that I really want to talk to you about, let's do a quick warm up so listeners get to know you beyond your bios. And so just it's a quick thing. Don't worry. Don't think about it too much. We won't hold you to it. Are you ready?
Ready.
Fire away.
Okay. Natalie first, then Dan. Natalie, coffee or tea?
Coffee.
Yes. Dan?
Coffee, hands down.
It's a coffee room over here. I love it. Natalie, morning person or night owl?
Morning.
Nice. How about you, Dan?
Both.
What? What do you not sleep?
I'm going to go with both on this one.
How does that work?
Yeah, talk to the wife. You have to talk to the wife.
Natalie, go to a recharging spot in your city.
Home.
Oh,
That's
yeah,
a great
that's
answer.
With my
Yeah.
kids and my husband. Yes.
I love it. How about you, Dan?
I'm going to have to go with the Visha Ferry General Store, a shameless plug, exit 8 off Clifton Park.
Yes, they're not sponsoring us,
No,
but
not
maybe they
sponsored.
should.
Great place
And
to get
you,
a coffee, a breakfast sandwich, and feel like you're in Anna Green Gables at the same time. So it's a great place to check it out.
yes, and you guys took me and my husband there recently
Yeah.
too, and it was so cute. We were just like, I bought like so many little things I didn't know I needed. Natalie, a book, podcast, or a resource that's lighting you up recently?
Podcast that I absolutely love is Maintenance Phase. I'm a big fan of going after wellness grifters and kind of learning about how the wellness space can be over complicated for people, and Maintenance Phase does an amazing job at that.
Interesting. I'll have to check it out. What about you, Dan?
Yeah, I've been actually, I don't have time for it, but I've been watching Glue Guys by it's Shane Battier, Alex Smith, and it's all about taking risks and calculated risks and how to be a good business owner. So it's pretty good.
Ooh,
Yeah.
love that. Business books. Yeah, I have been binging on business books recently. So speaking of business, let's dive into our MSO story. Natalie, can you tell me, okay, what is an MSO and why do we need to even think about it? Why did you think about it?
Yeah, so a managed services organization, or MSO, is not a new concept. We see it across many industries, including healthcare. Where you tend to see it more frequently in healthcare, number one would be private equity owned businesses that form an MSO of different practices or clinics. Or also you might see private practices that have an MSO for multiple locations that they own. But a managed services organization is really an entity that chooses, let's just simplify it down to a list of services that they are managing for their constituent clinics, let's say, or the parties that they are involved with. So it's best illustrated, I think, in an example of how we're doing it. Is we've got a managed services organization with a list of all the pain points, really, of owning your own DPC practice, and we help manage those services for the member DPC practices. And happy to go into more detail about how that even came about. So, as I mentioned, I started my practice 6 years ago. When I got here, there was already a couple of direct primary care practices in Pittsburgh, but the ship of DPC was very new here. Pittsburgh, I like to call it a very malignant city when it comes to healthcare. It's an incredibly loving city to be living in, and the neighborhoods are amazing. But with regard to healthcare, it's a very challenging environment. And DPC is a new concept for most places, right? So it's a lot of community education and telling our story of why we do what we do and what it means. So during the pandemic, right at the beginning there, when the vaccines started rolling out and we had no access to it as independent practitioners, and we were noticing other people in that similar situation, there was vaccine access for the accountants at the local big box health systems, for example. So myself and my colleague, who is a DPC doc and has her own practice, looked at each other and said, this is not okay. Like, we need to do something for the community. And so we were able to acquire vaccine from the state and lead grassroots efforts over about a 6-month period of time where we vaccinated thousands of people in Pittsburgh, including homebound patients. And it was after that movement where, two women who own DPC practices separately, mom of multiples, busy women out there, said, why don't we do more stuff together, right? Like, we just created magic just from passion. Why don't we do more together, and what would that look like? And so that led us down the path to try to understand how we could collaborate while maintaining autonomy. So many of us in DPC value our autonomy. That's why we went into direct primary care.
Right.
We want to remain independent and do our own thing. So how could we maintain that while still working together? And we ended up talking with an MSO private practice in Pittsburgh just to learn what their journey was like, and started to really understand how we could apply that to direct primary care. And at that time, when we started doing that, we didn't know of anybody else in the country doing what we were doing. So it was definitely flying by the seat of our pants.
We're good. I'm sure we're all good at being doctors, but now, this whole MSO is foreign to me. So for all the direct primary care doctors that are listening, can you just basically just tell us, what does your MSO do day in and day out when it comes to finance, HR, IT, marketing? What do you keep in-house yourself and what do you outsource?
Great. So the way we've structured this was my partner, Dr. Lynn, and I came up with a list of pain points. So for us, especially in a city of Pittsburgh, name recognition is everything. And so is geographic footprint, because there's people are so used to hear the big names literally on the tops of the biggest buildings in our city, like on our beautiful skyline. The big box health systems have their names on our buildings. So Pittsburgh is very familiar with name recognition when it comes to healthcare. So that was one thing. Cross coverage. We're all independent docs with only one person, micro practices. So cross coverage, if you actually wanted to leave town or have a break. Marketing goes along with that. So having that, name recognition, you also want a robust marketing system and people to help with talking about your practice eloquently and putting yourself out there to educate the community. And a multitude of other things, vaccine acquisition, mentorship, since Dr. Lynn and I had, the very longstanding practices at that point and had a lot of experience, providing the mentorship for new docs. And so we came up with this list, and that's not an exhaustive list, what I just mentioned, but we came up with this list of pain points and, things that we think docs going into practice and opening their DPC would really love to have. And then we manage those services. So we don't actually farm anything out other than the marketing team that we have right now. So Dr. Lynn and I manage everything. We don't have private equity. We don't have any investors. It is us. And we have 2 other practices that are part of the MSO. We are opening a third by the end of this year. And we are in talks at this point about potentially acquiring some more employer contracts pretty soon, which is exciting. Because when we have this geographic footprint with a shared entity, so Direct Care Physicians of Pittsburgh, so we all do business as that, and then tack our names on the end of it. We have that geographic footprint to then contract with employers and say, hey, you only have to sign with us, this one, MSO entity, and we will distribute, you go see whichever docs here you want. We will distribute those memberships to the docs accordingly. We don't take a cut from the docs. We have an admin fee for the employer, and that's how we've structured it.
Cool. Okay. So do the practices pay you anything at all for the marketing and everything?
Yes. So we then took that amount of money of what it costs to run and manage those services. And then we have that monthly membership as what the practices pay us per month.
Okay. All right. So walk us through the first 90 days of forming it. How did you and Dr. Lynn do it?
It's exhausting. I feel like I've kind of blocked that time out. So we did, it was a lot. We did a lot of bringing in key players and trying to understand different options. So, consulting with different people, lawyers, accountants, business coaches, just trying to figure out what this would even look like. And then it was a big push for us even to form a partnership, right? So we read the partnership charter. We really sat down together and figured out what this partnership between the two of us would look like as, co-owners of this business. And it's hard to find a partner that you work seamlessly with, right? Like that's challenging no matter what. So we were very fortunate to have found each other where literally we work like the same brain. And so it happens and we make it work together. So those early days were really a lot of just trying to figure out what this business structure would look like, what we would be offering. And a hard part was coming up with the finances and trying to understand what would be an appropriate membership amount, because we don't have this business right now to make money. We're honestly just at a, breaking even most of the time, because we really just wanted to have something that is bigger than us and we truly believe in. And that's what it's grown into because we've stuck with that mission.
That's wonderful.
Natalie, I have a quick question here. How do you and Dr. Lynn make those shared decisions? As doctors, we're all a little type A, a little OCD ourselves. So how do you get 2 separate doctors to make decisions on, say, budget allocations, onboarding new clinics, committees, voting thresholds? How do you work together to make that work well?
Yeah. So fortunately, the two of us have different skill sets. So we really spent a lot of time trying to nail down and understand what each of us brings to the table and how it's unique and how we can capitalize on each of those skill sets. So then we are able to lean into that. Like it goes from the little things of one of us is more tech savvy than the other, all the way up to one of us is really into advocacy and working with the medical society. One of us is really into social media and more speaking, like public speaking and community engagement. Right. So we have these different skill sets. And so we lean into those, whether it's going after, business clients or bringing on new docs or doc retention. Right. So it's retention of these member practices and making sure that this is worth their time and while. So a huge part of that is we both are in 100%, I can honestly say, alignment on what we want this MSO to look like. And we are also 100% aligned in understanding we may need to pivot and that this can change over time. And so with that alignment, we've been able to ebb and flow, right? Like opening a new business is challenging and continues to be. And we're able to make those changes as needed. So for us, it has not been a problem. And I think a lot of it is open communication. We are able to call each other out. Like if we don't like what something, the other person is saying, or we think this is not necessarily a great idea, straight up say it. And there's never a hard feeling, because the place it's coming from is actual trust and alignment.
Yeah. Yeah, that's so rare and so awesome that you found that, in a co-partner, and sounds like you guys have a great friendship.
The age of risk and compliance. So Natalie, what kind of legal guardrails do you put in place, especially around corporate practice of, the corporate practice of medicine, fee splitting, data privacy, which is so huge, to keep your clinical and business sides clearly separated?
So there's a couple ways. One is, my own practice is one thing, right? Which I think we understand from a DPC perspective, and you've got to kind of go through that with lawyer engagement and patient contracting. But from an MSO perspective, it is not a clinical entity. So we've made it abundantly clear that the MSO itself is not clinical. We are strictly managing services. And I think that's important. If there's a lawsuit, are we going to be sued? I'm sure, right? But the language and all of our, from one of the practices, I think, yes, we would be at risk for that. And we're abundantly aware of that, but it's in our contract, and it's baked in that we would not be a clinical part of a patient's care. We spent a ton of time with lawyers trying to come up with the right contracts. Even the contracts that we use with our employers, those are all, nailed down from a legal perspective. So a lot of it comes down to what those contracts look like and agreements look like.
So what do your employer contracts look like? You mentioned earlier that you charge the fee to the employer, not to the practices. Tell us a little bit about that.
Yeah. So first of all, we are very serious about being physician owned. And we're very serious about not having the corporate practice of medicine. And we're very careful about making sure that we aren't telling anybody how to practice medicine, first of all. And, we left the systems for a reason. We are very serious about being physician owned. And so for us, it's important to make sure that our docs are taken care of, especially when we're contracting with employers. We don't want to take a cut from the physicians practicing medicine and doing their job. We are providing administrative services to that employer, right? So that's why we cake in that fee to the employer themselves, is that administrative fee, along with the membership, per employee per month. And then we pass that membership money directly over to the docs. And then we take that administrative fee for ourselves.
Okay, so are you tracking like metrics for the employer, like A1Cs and that kind of thing, per practice, for quality and that kind of thing?
We're not doing any tracking of any data right now. We frankly have not had a big enough employer who has wanted that or asked for it. So we are in the position right now where we are entertaining some potential opportunities that may require something more robust. And so we're looking at what our options are out there for data tracking.
Okay.
Very nice. Very nice. Natalie, quick question here. So when I started off, and Disha, you're about to find this out, negotiating with vendors is a big chunk of our expenses. So with multiple clinics, multiple providers, how did you negotiate with vendors? How did you agree on, volume discounts that could help mitigate the costs all around?
So with our MSO, we don't start up these businesses for the docs, right? Like they are starting their own clinics, they're getting their own supplies and setting everything up from that perspective. We do a lot of sharing amongst the practices. So if somebody, you get a huge box of speculums and you don't need all of them, you can share them among the practices. One of the member practices, Dr. Scott, we actually share office space. So she subleases from me, and we do share supplies as well. So there's more of that, let's call it less formal cost sharing going on. Now, we do negotiate with a vaccine supplier company, which has been challenging over times. And we do actually have somebody who helps us make sure that that's all going well, right? Like that the supply is appropriately done and managed, that we have proper inventory, and that's kept up to date, because that can be really hard with multiple clinics. For labs, we up till recently had been using lab pricing with a lab, national lab supplier, and had really great pricing. And then for some of us, the electronic medical record that we use has started to get even better pricing through that company. So we've been using that pricing instead as individual practices.
What EMR is that, if you don't mind me asking?
Atlas.
Oh, okay. I can imagine that solo practice gets pretty lonely I've heard that from some DPC docs. Did creating this MSO make you feel more supported and have, peers to support you? Did that help?
So that was a huge impetus, I think, when we were trying to come up with our list of shared services, right? A lot of it is what Dr. Lynn and I call the soft stuff, right? The mentorship, the group text that we have together, right? Like, what specialist do you like for this issue? Hey, how would you handle this case? But we also did some more formal steps, which one of them is having a balance group. So I remember doing this in med school, where there's a challenging psychosocial case with a patient. You have a third party. So in our case, we have a therapist who sits with us quarterly. We all meet on Zoom, and that doc presents their case, obviously de-identified. And then we help work through it together. So there's that really nice support system right there, because all of us have those cases, right? As physicians, that's what we're going through on a regular basis.
Yeah.
We also have quarterly meetings. So Dr. Lynn and I meet quarterly individually with the member practices, member docs, and sit and say, how's it going? What do you need help with? What can we troubleshoot for you? And we also have biannual meetings, all of us together. So we've really found this wonderful camaraderie together and support system, along with the cross coverage. You just do not feel alone.
That's wonderful. Do you have VAs like helping you with this? Because it sounds like a lot of management.
Mm-hmm.
We have no VAs helping us with the MSO right now. We, if things go forward with the current deal that we are working on, we will need to bring on administrative help. Yes, because then it'll be too much for the two of us to handle. But for right now, Dr. Lynn and I have been able to manage it ourselves.
Wow, that's so amazing.
Yeah, Natalie, just switching gears here from a patient perspective, I thought the patients have it made the way we do it now, solo direct primary care. But when you add your MSO model, multiple partners or multiple providers, what's changed? What's improved in terms of, after hours coverage, access, ancillary services? I know you do offer a lot more than just general primary care. I know you have a teaching kitchen, fitness classes, group visits. Can you just let me know what's different than when you were practicing totally solo?
So not much has changed from the patient perspective with the introduction of the MSO, because I'm still their doc. Each of these individual practices have their own patient panels. I'd say the only thing that really has changed is the cross coverage. So if I'm out of town, like I'm going this weekend and completely off the grid, one of the docs will be cross covering for us. So the patients do get an interaction with another doc on a more acute, urgent need when those cross coverage events happen. But those in general are pretty rare anyway. But my patients in my practice have continued to be able to experience having access to my wellness center, having the teaching kitchen, doing the lifestyle medicine work as well. And then I also own that third business, which is Rebel Wellness, which you're referring to, which is my wellness studio. And that's been incredible, to be able to have that as part of my DPC, but also as a separate business entity, has been absolutely a dream come true. But the MSO, is not affecting our practice of medicine and or our patient care. So it's like this added bonus, right? It's this like cherry on top that we aren't alone, have these services, have this help, but can still practice medicine the way we want to.
Amazing. Thank you.
So, Natalie, what is your due diligence checklist? If a new practice is wanting to join your MSO, what do you do to screen them and onboard them and ensure quality?
Yeah, it's really important to us that we have, again, back to alignment, right? And similar culture that we're trying to have amongst our practices. And so we do meet with these docs. We learn about what they're interested in, why they want to go into DPC, help to, learn more about what their journey has been. And I always call it courting, right? Like we're courting them. We're learning about each other, and it's usually many meetings. A lot of times they come to our different offices and come and see what those setups look like. And from there, then we go forward with signing the managed services agreement before we necessarily would talk in great detail about setting up their practice. And from there, they get handed to our marketing team and start to learn how to feel comfortable from that perspective, getting the press releases sent out about them opening their practices. And we're there every step of the way. So Dr. Lynn and I and the other docs, the other member docs now are becoming mentors for new docs, right? And so we all kind of lean on each other. But it really is a very long process. So we hear from probably several docs a month at this point that are wanting to do something like this, right? They're wanting to take a leap and go into DPC. They're not happy in the system, but it's very few that end up actually taking that leap.
Right.
And so we are in the long game. And I think most of us in DPC, especially those of us who like work with employers, right? Or those of us who have been trying to have this long game of like, I'm going to tell you what I do. This is what I'm all about. But then we don't hear from someone for years. That's
Right.
not unusual when it comes to DPC. And it's not unusual from our MSO growth either. We're seeing.
Yeah. Everyone loves the concept, but actually taking the leap is very scary.
It's terrifying. Yeah.
On that part, I'm going to kind of give a two-part question. So what was the hardest part that, speaking of people not setting up, what was one mistake you'd help others avoid? And also, if things go well, could this ball be, applied to other places, other cities, like Albany, for example?
We hear from a lot of people around the country now that are wanting to set up MSOs. So we've spoken about it at DPC Summit. We're actually in the process of creating a course about it. So we're getting a lot of interest of people wanting to do this in their own regions, which is super exciting. I would say two things. Number one, just because you are linked up with an MSO does not mean, at least in the type of MSO we have, does not mean that you don't need to put in the work to grow your practice, right? And I think that's something we try to really stress to the docs who are joining as member practices. You still have to hustle. It's still you. It's still your practice, right? And I think that can sometimes be hard, especially for physicians. We're not used to selling ourselves and what we have to offer. And we're used to being in a system where a patient panel is handed to us and we are drinking from a fire hydrant automatically. And that's just not the case when you first open doors with your own practice. So I think having those frank discussions and letting them know we're going to give you the resources, but you also have to hustle and put in the work to really grow your practice to the extent you want it to grow. With regard to scaling this to other regions, one of the conversations that I've had with other places wanting to do this is you've got to ask yourself why. Like, what's the point? What is this going to serve for you? And coming up with that problem list, if those problems can be solved without forming an MSO and forming a new entity and trying to work with multiple people together, then don't do it, right? I mean, it's a huge lift. This was an enormous lift for myself and Dr. Lynn financially, emotionally, and time-wise, right? And that we aren't going to get those things back. So I think it's important to know, is the juice worth the squeeze for you in the end to take this type of leap? And it's interesting with some of these people we've talked to around the country, in the end, it isn't worth it for them. And having those really frank conversations is very important upfront.
So why was it worth it to you?
So I was born and raised in Pittsburgh. So this city means an immense amount to me. And I grew up with a physician for a dad and a nurse for a mom. And I saw how the healthcare landscape here has changed immensely over time. I am seeing my colleagues going through moral injury and experiencing, discouragement in their positions in the system. And again, speaking to what the healthcare landscape is like in Pittsburgh, I don't want it to look this way. And I want to be part of the change. And for me, being part of that change, of course, is my own practice, but it was also raising this movement of DPC in the city to show that there is a better way and that we have more of that footprint here and that we can provide that for patients here in this city, even though many people think their only option is these big systems. So for me, it was this bigger goal of supporting and mentoring other docs to take this leap and helping them through that process, because we are only one person alone, right? When we're solo, we're alone. So how can we make this movement together while still maintaining that autonomy and taking back power as physicians?
I love that. And I love that it comes from such a benevolent place. And it sounds like it was a lot of work on you to get it done, but that's wonderful. And it's really nice to see, physicians doing just stuff out of the goodness of their heart, not because of money, even though money is important. Let me ask you one last question. You said you're basically breaking even at this point. There's a lot of interest at the conference. There's a lot of talk about MSOs being bought by private equity. Do you see yourself ever selling this MSO to someone else?
I mean, I can never predict the future. I think the finger on the pulse with myself and Dr. Lynn up to this point has been, we want this to be physician owned and we don't want to be owned by private equity. Interestingly, we are seeing how that's playing out across the country and locally when you have docs still being owned by non-doctors. And it's not something we have interest in being part of. We are slowly making money, breaking even to making money, and that's happening over time. And for us, that is enough. We know that if we keep on with this mission and just stay true to it, we know it's going to play out well. It has already proving to. And so for us, it was really just keeping our heads down and just plowing forward, because I am not speaking. I don't think it's selling out to go to private equity. I would never judge that decision. For us, it just does not align with us.
So what's the 5-year plan for your MSO?
Mm-hmm.
Where do you see yourself growing?
We'd love to have more regional footprint west of our city as well as east of our city. We have city north and south right now. So Pittsburgh kind of being in the middle, we'd like to branch out to those other quadrants. And we also would like to start to work with bigger employer contracts, bringing on some new docs to help take on some of those patients. And we've got some of those things in the works right now, and trying to figure out how we can make that happen. So it's really growing the expanse of practices that we work with, and bringing on some employers. But I think the thing we absolutely cannot forget and won't forget is that physician retention, and just making sure that this has continued to be a value add for the docs that we're already engaged with.
Wonderful. Dan, do you have any more questions?
I'm happy. This is great. No, I'm good for now.
All right. Well, I'll wrap things up. Natalie, this was gold. Thank you so much for walking us through why, how, and the lessons you learned along the way.
Great, Natalie. I mean, thank you so much. You can tell your heart's into it. And thank you for giving even a solo DPC doctor as myself, just so many practical takeaways for us who want to, scale this, build community, and at the same time have our own independence as well. So thank you very much.
Thank you. Thank you for the opportunity.
We'll link to Direct Care Physicians of Pittsburgh, Gentile Family DPC, and Rebel Wellness in the show notes. If this episode helped you, please follow, rate, and share the Finding Financial Freedom podcast with the Frugal Physician. And as always, stay frugal, y'all.
The content shared on this podcast should not be taken as individualized financial advice. We are here to share our knowledge and experiences, but it is crucial to consult with professionals such as accountants, financial advisors, or attorneys who can provide personalized guidance based on your specific needs.